of Zoological Society of Nigeria to our environment, to the growth of animals in this country, and the ecosystem?
When you said animals, you saw me smile. People always have this, yes, that zoology has to do with animals in the sense of wildlife. But we all know we're also animals, but at the higher level. So it's not just about animals. Most of the public health works in Nigeria has been pioneered by zoologists. You could see from one of the keynote speakers, he's a very prominent person when it comes to viruses, Ebola, COVID, all of those infections. So zoology has contributed immensely in the public health sector of Nigeria, especially in terms of disease control. For instance, river blindness was a very serious disease, especially in North Central Africa. It was the hub of that disease. And part of the people who were involved in the research that came up with the best way to control the disease were zoologists. The medicines were available, but the problem was, how do you deploy this medicine? Because onchocerciasis is a disease they call it disease of the end of the road, because you find them in very impoverished communities where you don't have government presence. And when you don't have government presence, sometimes they don't even have health clinics. And then even when you have these health clinics, the health workers are overburdened. So it was zoologists that came up with the idea of, there's no big deal about this thing. We can train the community members to treat themselves using stick to determine dosage. And that has helped immensely in controlling neglected tropical diseases in Nigeria and even Africa. Onchocerciasis, schistosomiasis, so many, about 8 of these diseases.
Ma, your contributions to this field of study, what are some of those contributions, which I believe should be the reason for today's fellowship?
Okay, I will just pick on one, which is lymphatic filariasis. I would say I'm among the pioneer people in the country who have engaged in the control of lymphatic filariasis, especially the morbid presentations. Elephantiasis. Let me use very common terms. Elephantiasis, you see people with big legs, sometimes huge scrotum. For a very long time, up to today, people think it is something spiritual, but believe you me, it's mosquitoes. Yes. So I was one of those few people who were trained in Tanzania in 2003 on how to manage elephantiasis and hydrocele, scrotal enlargements. So far, I would say I have trained over 300 in North-East and North-Central Nigeria, health workers and patients on how to manage it. Even the Southwest, I've been involved with training health workers and patients in Osun State, and we have had very good success stories from patients.
Your name once again, ma'am?
Jacqueline Azumi Badaki.
Professor of
Parasitology and Entomology.
I can call it, he can call it.